Hello, and welcome to the Maryland Primary Care Program and HCD International's Care Transformation Organization presentation. My name is Leah Chambers, and I will be your presenter for today's presentation. In today's agenda, we will cover the program background, program requirements and payment, practice eligibility, what a care transformation organization is, and HCD International's CTO. In other words, a care transformation organization. Program background. What is the Maryland Primary Care Program, on short, MDPCP? The state of Maryland entered a total cost of care all payment model contract with the federal government that is designed to coordinate care for patients across both hospital and non-hospital settings to improve the health outcomes and constrain the growth of healthcare costs in Maryland. A key element of the model is the development of the Maryland Primary Care Program, MDPCP. MDPCP is a voluntary program open to all qualifying Maryland primary care providers that provides funding and support for the delivery of advanced primary care through the state. The MDPCP supports the overall health for transformation process and allows primary care providers to play an increased role in prevention management of chronic disease and preventing unnecessary hospital utilization. MDPCP background and program goals. MDPCP is a statewide advanced primary care program. The goal is to build a strong, effective primary care delivery system inclusive of medical, behavioral, and social needs. MDPCP is part of the Maryland Total Cost of Care model, a statewide healthcare delivery transformation. And its goal is to reduce the TCOC, total cost of care, by improving health and providing the best care at the right time, at the right place. Now I want to share an overview and CMS beliefs of the program. MDPCP began in January 1st, 2019, and ends on December 31st, 2026. The initiative has 3 tracks for participant practices that are primary care specialists. Those 3 tracks are Track 1, Track 2, and Track 3. In Track 2 and Track 3, increased care redesign expectations are needed, and you will receive payments for those tracks to indicate the expectations in care that CMS would like to see from participating practices. CMS believes that MDPCP can reduce costs and improve the quality of care for Maryland Medicare beneficiaries in a manner that is aligned with the goals of the TCOC model. CMS will support these primary care practices and FQHC's transformation efforts by making payments for enhanced care management as well as performance-based payments to participant practices. All eligible primary care practices and FQHCs within the state are invited to apply to participate in MDPCP. On this slide, I will share the growth of MDPCP as of 2022. In 2019, there were 380 practices in MDPCP, and as of 2022, there are over 545 practices that participate. Over 375,000 beneficiaries attributed have been assists, and over 4 million mail-inders. Program requirements and payments. In the next few slides, I will share an overview of the program requirements, in simple terms, the payments for MDPCP. Key parts of MDPCP. MDPCP is a key part of the statewide integrated health improvement strategy designed to engage state agencies and private sector partners to collaborate and invest in improving health, addressing disparities, and reducing costs for mail-orders. The key facts for doing these efforts are incorporating health equity lenses, reducing risk-adjusted PQIs, improving post-discharge follow-up, addressing substance use disorder, reducing BMI, and integrating public health. MDPCP Advanced Primary Care Requirements. MDPCP requires 5 care transformation requirements. Those are access and continuity, care management, comprehensive and coordination, beneficiary and caregiver experience, and planned care for health outcomes. These advanced primary care requirements are necessarily and they must be met for all tracks. Program eligibility. There are 4 main program eligibility to be accepted into MDPCP. You must meet CMS program integrity standards, provide services to a minimum of 125 attributed beneficiaries, Medicare beneficiaries, and it must be that within the last 18 months. You have to have 125 attributed beneficiaries within 18 months. It can only be Maryland practices, and you must utilize a 2015 certified electronic health record. And for the EHR, they will ask you for the certification number on the day that you submit your application. Program restrictions. There cannot be any complex fees or charges for Medicare beneficiaries. You cannot be in a next generation ACO model or a comprehensive ESRD care model, and you cannot be in a Medicaid health home. For participants that join MDPCP, you must have CHRIS. You must have CHRIS Health Information Exchange. It's very important that you understand that. The reason so is because there are different reports that you must obtain and that must be submitted through CHRIS for MDPCP. You will receive care alerts. You will receive reports such as likelihood of avoidable hospital events tools, and you must read that report so you can ensure that you keep those patients out of the hospital. And you must submit an E&S report at least every 90 days within 90 days of Q3 of reporting. Payment initiatives in the MDPCP tracks 1 and 2. As previously mentioned, we have 3 different tracks. Track 3 is the most recent track for MDPCP. That can be shared later once you join the program. There is a care management fee, a performance-based incentive payment, PBIP, and a comprehensive primary care payment. For each track, as previously mentioned before, it is very important that you follow the 5 main functions to stay within the program. MDPCP follows the value-based comprehensive care reward model for payment incentives. In this reward model, practices are paid for every Medicare beneficiary attributed to their practice. Each patient is ranked based upon their complex care. Please note that additionally, with the reward model, practices will still get compensated on the advanced payment model. So in short, practices will get compensation through the reward model and also to be compensated for fee for service. I wanted to make sure that I highlight that you will get paid for both models, but please note, you cannot charge the same performance base for fee for service, and CMS will not pay you for those that you charge for fee to serve. MDPCP also have another payment called the HEART payment. HEART stands for Health, Equity, Advancement Resource, and Transformation Payment. All practices will receive CMS, care management fees. Some practices will also receive a HEART payment for eligible beneficiaries. To receive this payment, patients must have either a high medical complexity, HCC, or a high area depreciation index, ADI. Program eligibility. There are different specialists and specialties that can submit an application for MDPCP. To name a few, you can have a general practice, you can be in family medicine, internal medicine, OBGYN, pediatric medicine, prevention medicine, you can be a physician assistant, a clinical nurse specialist, or a certified nurse midwife. Practitioners identified with a primary specialty code of psychiatry must be co-located with an eligible practitioner with a primary specialty code other than psychiatry in order to participate with for the MDPCP program. Please note that this program is for primary care practices, but there are different eligible specialties that can be listed for you to join the program. Please make sure that you have a specific NPI number that falls under the category of one of the eligible codes that you see on the screen. Or if not, there is a possibility that you would not join MDPCP should you want to join. Care Transformation Organization. How practices are supported to succeed in MDPCP. I know the biggest question that you're probably asking yourself, why MDPCP? What exactly could it do differently from my practice? There are a few things. Practices are very much supported in the MDPCP program. You have resources such as CRIS, state contractors, practice coaches, learning systems, CMS Enterprise Portal, and more importantly, a CTO. There are many benefits of joining a CTO if you join the MDPCP program. The role of a care transformation organization, CTO, as previously mentioned. A care transformation organization is on request and it assists the practice in meeting care transformation requirements. A CTO partners with the practice and they can offer services such as care coordination services, support to care transitions, data analytics and informatics, standardized screenings, and assistance with meeting care transformation requirements. Examples of certain personnel that can assist practices are care managers, pharmacists, social workers, and community health workers. Please note that there are different partnerships, collaborations, and splits should you want to partner with a CTO. The CTO's overall role in the program. A CTO will provide services that are integral to meeting the care transformation requirements, but do not require the personal professional services of a physician. They just need minor supervision from a provider or an office or a practice champion. CTO's goal is to enhance capacity of practices to provide care management services, improve workflows, and manage their populations. They also provide embedded resources at the request of the practice and or provide services to patients in the community, and they offer services similar to chronic care management fees. As previously mentioned earlier in the presentation, that MDPCP have grown since 2022, from 2019 to 2022. The benefits of partnering with a CTO, as you can see from the state, there are 77% of practices who join a CTO to help with your care transformation, with your care plans, and with your workflow, so you can give better customer excellence to your Medicare beneficiaries. So now that leads us to HCD International CTO. Who are we? Healthcare Dynamics International, for short HCDI or HCD International, is a care transformation organization participating in the Maryland Primary Care Program. We've been an active CTO since the program launched. As a health consulting firm, we are familiar with the demographic and geography you serve. We have critical insights into what resources will enhance your patient impact. We aim to support two outcomes when it comes to healthcare CTO services. One, that patients will receive the highest quality of care, especially the most vulnerable, high risk, and hard to reach patients. And practices like yours get the maximum incentives for delivering quality care. So if you would like to get to know HCD International, your next care transformation organization, please feel free to send an email to ctoinfo@hcdi.com. And please, when you have a moment, visit HCD International CTO website at www.hcdi.com/CTO/. I want to thank you for taking some time to listen to the introduction of MDPCP and HCDI's CTO presentation.